Injury Center, and the purpose of this video is to speak to a certain segment of our population that's primarily women. Now, I want to talk to you about calcium supplements because I know a lot of you, when you go to your doctor, you may have had a test and you've been told that you have osteopenia, which is a precursor to osteoporosis, or you're developing osteoporosis, or you have osteoporosis. So one of the first things they do is to tell you to take 1,000 milligrams of calcium every day. And that is not the answer to the problem. That's not your solution. Now, many of us, we're seeing now in the research and in the patient demographics that are coming in, these individuals that are on the calcium supplements, it's not uncommon for them to have increased tartar deposits in the teeth. You know, when you go to the doctor, your dentist, and he or she is digging with that little pointed stylus and they're scraping the back of your teeth or whatever because you have a tartar buildup. Or you're finding out that even at your young age, you go in for an eye exam and the doctor's telling you that you're developing cataracts. Or at a young age, you're finding out that, golly, my joints are stiff and they're sore. Or you go to the doctor and he or she is telling you that you're starting to develop one of the most common types of arthritis, which is osteoarthritis. And or you're going to the doctor because you have this back pain that's gnawing and that, only to find out you're developing kidney stones. All of these problems have one thing in common. They can all be the result of too much calcium in your body, or I should say, the calcium that you're not taking is not being absorbed by the body, so it's being dispersed in other areas, which is resulting in the tartar buildup, the cataracts, the kidney stones, the arthritic problems and whatnot. Now look, also I want you to think about this because you know yourself better than anybody. If you're an individual that's taking calcium and you're on a proton pump inhibitor, you know you're taking the Prilosec, the Prevacid, the Nexium, whatever it is, this for the GERD or the antacid problems, that is the wrong thing to do. You also may have this problem because you're taking calcium and you have a mineral imbalance. What happens in the world is, and this is one of the keys to having good health in your body, everything has to be balanced. There's not just a one answer that is the solution that cures the problem. There's always a balance. There's a synergistic or a recipe, if you will, of different ingredients working harmoniously with one another to produce the desired results. In this case, it would be health. But getting back to the point, it could be that you're having too much calcium and not enough of the other minerals. Also, it could be your diet where your blood pH is too acidic. It's the most important of all of the different pH levels in the body is the blood pH. So if you're prone to eating a very acidic diet or eating a lot of sugars or whatever it may be, your body then is going to always, because it is fearfully and wonderfully made, it's going to always work on keeping itself healthy. And first things first, that is maintaining the pH of the blood. So in order to do that, it's going to be drawing minerals out of the bones in order to buffer this, in order to keep that pH at the right level, which may create the imbalance as well. Okay? Now, another problem is the FDA was telling everybody, you know, you need at least 1,000 milligrams of calcium a day. It's not good advice at all. Now, what they're doing is they're recommending that you increase it to 1,300 milligrams a day, which is even worse advice. Okay, it just isn't working. That's not the solution. It's actually exacerbating or worsening the problem. All right, so some of the solutions I've listed here. What you want to do is increase your stomach acid. You want to stop taking the proton pump inhibitors. And look, if you're having a problem with digestion, then talk to your doctor, whoever it is that you see. Talk about getting a digestive aid. And also, you know, some simple things: chew your food more, eat slower, take smaller bites, do those kinds of simple changes, and you might notice that you're able to digest the food easier. And as I said a few moments ago, talk to your doctor about getting a whole food or a natural digestive some digestive enzymes to help you out. But certainly you don't want to take a proton pump inhibitor. You don't want to take that garbage. It literally is killing you. Also, talk to your doctor about increasing your magnesium. It is probably the single most deficient essential mineral in the whole scheme of things is magnesium. We have a calcium overdose and a magnesium insufficiency, which is lending to the problem. As a matter of fact, if I see in our center, if we see individuals coming to us that have been diagnosed with osteopenia or osteoporosis, one of the first things we do is to check them for their magnesium level, not their calcium level. And then also the vitamin D. Oh my gosh. There's so many people today are devoid of vitamin D, very, very low. And even the standards that are on in many of these labs is far too low. You've got to get an ample amount of vitamin D. So what we have are people going to the internet, they're self-diagnosing, self-treating, and they're buying these vitamin D supplements and whatnot, which is really not a vitamin, but I don't want to digress. When you're taking vitamin D, it is imperative. Like I said, it has to be jointly, there have to be other things that are connected to the vitamin D. It's no exception. So with the vitamin D, you have to have the vitamin Ks with them, the K1, K2, in order for the vitamin D even to be absorbed and utilized by the body. So if you're taking the famous D3 and it doesn't have the Ks with it, forget it. It's not helping you at all. So those are some of the things that you want to do. But remember, the problem at the bottom line for some of these, now I'm not saying it's exclusive, but if you are an individual that's faithfully taking your calcium supplements every day in order to offset the effects of osteoporosis or osteopenia or whatever, and you are an individual who now, out of the clear blue, is starting to have problems in their joints, joint pains, or you've been told you're developing cataracts, or you've been told that you're developing kidney stones or having an ongoing issue with kidney stones, or when you go to the dentist to get your teeth cleaned, they're going, oh my gosh, Molly, you've got all this tartar buildup, I don't know, and you're going, my goodness, I come in to get my teeth cleaned, I brush 3-4 times a day, how could I have this tartar buildup? Well, it could be the calcium, all right? So that's a conversation you want to have with your doctor the next time you go in and visit he or she, and ask them what kind of solutions you need, because it's not a carte blanche, it's not a shotgun approach that you want to resolve this with. Everybody is unique. Everybody has specific needs. You want to find out what your specific need is so that you can go ahead and get the problem taken care of. Hey, thanks so much for allowing me to share this information with you. And until the next video, and always, God bless.